Hi, welcome back to Vital Sphere. Shortness of breath, or dyspnea, can be a symptom of a variety of conditions, ranging from mild to severe. The severity of shortness of breath can be broken down into stages, which may be related to different health conditions. Stages of shortness of breath. 1. Mild shortness of breath occurs during physical activity or exertion. Breathing may become slightly labored, but it improves with rest. Common causes: anxiety, mild asthma, or overexertion. 2. Moderate shortness of breath occurs with less exertion, such as walking on flat ground or doing light household chores, may cause noticeable discomfort and require some effort to catch your breath. Common causes: asthma, COPD, mild heart conditions. 3. Severe shortness of breath occurs with minimal physical activity or even at rest. Breathing may become rapid or shallow, and it may be difficult to catch your breath even when sitting still. Common causes: advanced heart failure, severe COPD, pneumonia, pulmonary embolism, severe asthma attacks. For life-threatening shortness of breath occurs at rest and may be accompanied by symptoms like chest pain, confusion, or a feeling of suffocation. Breathing may be extremely labored, and there may be a bluish color in the lips or extremities. Common causes: acute heart failure, severe asthma attacks, large pulmonary embolism, or respiratory failure. Possible complications of shortness of breath: respiratory failure, when the lungs can't provide enough oxygen to the body or remove enough carbon dioxide. Hypoxia, low oxygen levels in the blood, which can damage organs. Heart strain, difficulty breathing can increase strain on the heart, potentially leading to heart failure in severe cases. Panic and anxiety, chronic shortness of breath can contribute to anxiety, which may worsen the symptoms. If shortness of breath is severe or persistent, it's important to consult a healthcare provider to determine the underlying cause and get appropriate treatment. Shortness of breath and the urge to take deep breaths can be early symptoms of several chronic diseases. Here are some major conditions that may present with these symptoms in their early stages. 1. Chronic obstructive pulmonary disease. Early symptoms: mild shortness of breath, especially after physical exertion, occasional cough, increased mucus production, cause long-term lung damage due to smoking, pollution, or occupational exposure. Progression: symptoms worsen over time, leading to chronic respiratory distress. 2. Asthma early symptoms: difficulty breathing, wheezing, chest tightness, frequent deep breaths, cause inflammation and narrowing of the airways, often triggered by allergens, exercise, or infections. Progression can lead to severe attacks if left untreated. 3. Heart failure. Early symptoms: breathlessness during physical activity, swelling in legs, fatigue, cause weakened heart function leading to fluid buildup in the lungs. Progression: worsening breathlessness, even at rest, with a risk of heart complications. 4. Pulmonary hypertension. Early symptoms: unexplained shortness of breath, fatigue, dizziness, chest pain, cause high blood pressure in the arteries of the lungs, making it harder for the heart to pump blood. Progression can lead to heart failure if untreated. 5. Anemia. Early symptoms: breathlessness even with mild exertion, dizziness, pale skin, fatigue, cause low red blood cell count reduces oxygen supply to Progression can cause severe weakness, heart strain, and cognitive issues. 6. Lung fibrosis. Early symptoms: gradual onset of breathlessness, persistent dry cough, fatigue, cause scarring of lung tissue, often idiopathic or due to environmental exposure. Progression leads to severe lung damage and respiratory failure. 7. Anxiety or panic disorder. Early symptoms: frequent need to take deep breaths, feeling of air, hunger, chest tightness, dizziness, cause stress, hyperventilation, or panic attacks. Progression can lead to chronic breathing issues if not managed. 8. Obstructive sleep apnea. Early symptoms: waking up gasping for breath, daytime fatigue, loud snoring. Cause: repeated airway obstruction during sleep, leading to low oxygen levels. Progression: increases risk of high blood pressure, heart disease, and stroke. 9. Gastroesophageal reflux disease. Early symptoms: shortness of breath after eating, difficulty taking deep breaths, chronic cough. Cause: acid reflux irritating the lungs and airways. Progression: can worsen respiratory symptoms and cause chronic inflammation. 10. Thyroid disorders, early symptoms, breathlessness, fatigue, weight changes, irregular heartbeat. Cause hormonal imbalance affecting metabolism and oxygen use. Progression can cause heart and lung complications over time. If someone experiences persistent shortness of breath or the need to take deep breaths frequently, it is essential to seek medical evaluation to diagnose the underlying cause early and prevent complications. Share with us if you have any experience to share about shortness of breath. Thank you for watching at Vital Sphere. See you on our next video. Real stories of shortness of breath and how plants can help. Story 1. I thought it was just anxiety. Sarah's story. Sarah, a 35-year-old marketing professional, had been experiencing frequent shortness of breath for months. Initially, she thought it was due to stress and anxiety, as she often felt breathless during work meetings. However, the symptoms worsened. She started waking up, gasping for air at night. After visiting a doctor, she was diagnosed with obstructive sleep apnea. The doctor explained that her airway was collapsing during sleep, causing oxygen levels to drop. With a CPAP machine and lifestyle changes, her breathing improved significantly. How plants help. Snake plant and aloe vera. These plants release oxygen at night, improving air quality and aiding sleep. Erica palm acts as a natural humidifier, reducing dryness that can worsen breathing issues. Professional advice. If you wake up gasping for air or feel exhausted despite sleeping, consult a sleep specialist. Sleep apnea can increase the risk of heart disease and stroke if untreated. Story 2. A silent heart problem. Mark's story. Mark, a 52-year-old construction worker, started experiencing breathlessness while climbing stairs. He assumed it was just aging and lack of fitness. However, he also felt occasional chest discomfort and fatigue. One day, after feeling extremely breathless and dizzy, he went to the emergency room. Tests revealed he had early-stage heart failure due to undiagnosed high blood pressure. With medication, diet changes, and exercise, he regained his energy and avoided further complications. How plants help. Peace lily and spider plant. These plants absorb toxins like carbon monoxide, which can put extra stress on the heart. Boston fern helps maintain indoor humidity, which is beneficial for cardiovascular health. Professional advice. Don't ignore breathlessness, especially if it occurs with chest pain or fatigue. Heart disease can be silent. Get regular checkups, especially if you have risk factors like high blood pressure or diabetes. Story 3. I thought it was just a cold. Aisha's story. A 40-year-old teacher developed a lingering cough and shortness of breath. Initially, she assumed it was a mild flu, but weeks later, even walking short distances made her breathless. A visit to the doctor revealed early stage, likely from secondhand smoke exposure. Her doctor prescribed inhalers and advised her to improve indoor air quality. With proper management, her symptoms stabilized, and she continued her job without major disruptions. How plants help. Erica palm and bamboo palm. Natural air purifiers that remove formaldehyde and other pollutants that can worsen lung conditions. Chrysanthemum filters toxins like ammonia and benzene that irritate the lungs. Professional advice. A persistent cough with breathlessness should not be ignored. Early diagnosis of lung conditions like COPD can help prevent severe damage. Story 4. The hidden link between GERD and breathing. Daniel's story. Daniel, a 28-year-old fitness enthusiast, started experiencing episodes of shortness of breath, especially after eating. He also noticed occasional chest tightness but no pain. Thinking it was asthma, he tried using an inhaler, but it didn't help. After visiting a he was diagnosed with GERD, where stomach acid was irritating his lungs. By avoiding late-night meals, reducing spicy food, and using prescribed medication, his breathing improved. How plants help. Lavender and jasmine. Their scent can promote relaxation, reducing stress-induced GERD symptoms. Aloe vera improves air quality while also being a natural anti-inflammatory when consumed properly. Professional advice. If shortness of breath worsens after eating, GERD might be the cause. Managing acid reflux with diet and medication can prevent lung complications. How indoor plants can help with shortness of breath. Many people don't realize that poor air quality can contribute to breathing problems. Common indoor air pollutants like dust, mold, volatile organic compounds, and carbon monoxide can worsen respiratory conditions. Best air purifying plants for breathing issues. Snake plant converts CO2 into oxygen at night, making it ideal for bedrooms. Erica palm adds moisture to the air, reducing respiratory irritation. Spider plant absorbs carbon monoxide and toxins. Peace lily removes common toxins like benzene, formaldehyde, and mold spores. Aloe vera improves air quality and has healing properties. Final takeaways from experts. 1. Shortness of breath is never normal. If it is persistent or worsening, seek medical evaluation. 2. Air quality plays a major role in lung and heart health. Keeping indoor plants can help filter toxins and improve oxygen levels. 3. Early diagnosis can save lives. Heart, lung, and even digestive disorders can present with breathing issues. If you or someone you know is experiencing unexplained shortness of breath, don't wait, get checked by a healthcare professional and consider improving your indoor air quality with air purifying plants. Thank you for watching at Vital Sphere. Check our next video.